organ of the body, and it acts as a protector and shield, as well as mirror and beautifier, and sometimes referred as the poster child of the face. Is most visible of all parts of the body and admired, most admired too, but it's also the most abused organ of the body. In fact, on no other part of the body can the evidence of our dissatisfaction and ingratitude to our creator be displayed like as it happens on the skin. It's a great source of grief for many, hence the boom in the cosmetic industry, just because people are looking for remedies to their perceived skin issues. So talking about the structure of the skin now, because it's related to the function of the skin. The skin is made up of the epidermis, the dermis, and the hypodermis, also called the subcutaneous layers. And the stratum corneum is the upper layer of the epidermis. And under the microscope, it looks like brick and mortar with the corneocytes as the bricks. And these are glued together or tightly bound by mortar-like fats like ceramides, cholesterol, and fatty acid. This layer also contains a protein called filaggrin, which helps to make natural moisturizing factors. Hence, when you have deficiency of filaggrin, you're going to be having issues where you have excessive dryness of the skin and increased permeability of skin, like you have in patients with atopic dermatitis. The skin also, this uppermost layer of the skin, the epidermis, also harbors the skin appendages, even though things like the hair follicles, they arise from the epidermis, but they deep down to the dermis, where they are supported by some components of the dermis. You also have the sebaceous glands that secrete sebum, oily substance, and all these arise from this layer. Part of the skin appendages include the nails and then the sweat glands. The melanocytes, which impart pigmentation to a person's skin, they rest on the basal layer of the epidermis, but they have their origin actually in the dermis and migrate upwards. So while the epidermal appendages deep down, the melanocytes migrate upwards. This is like hair, one of the skin appendages, with the shaft here and then the sebaceous gland that empties its contents around the shaft of the hair. The dermis, which is the second layer, is a thick, dense connective tissue layer consisting of collagen, elastic fibers, matrix, cells like fibrocytes, histiocytes, and mastocytes. The matrix and fibers support the cutaneous blood vessels and lymphatics, as well as the nerves. And they also support the epidermal appendages that we talked about, that deep down from the epidermis to the dermis. The subcutaneous tissue is a thick, deep layer of connective tissue that specializes in formation of fat. It acts as a cushion and helps in insulation, thermogenesis is one of the functions of this layer, whether it's shivering or non-shivering thermogenesis. And the principal cell here is the lipocyte, the fat cells. Of course, from the foregoing, you can see that variation in skin thickness and structure will be based on the functions they are supposed to perform. The more friction and area of the body is to come in contact, with the more an area of the body is to come in contact with friction, the thicker that area is going to be, like the palms and soles of the feet, okay, compared to how soft the skin around the axilla and the genitalia may be. So now coming to the functions, which is the major talking about the protective function of the skin, this outermost layer being the epidermis, okay? And the outermost layer of this epidermis, the stratum corneum, is the first line of defense of the body against invading organisms and the environmental threats, okay? It's a physical barrier, and it protects the body's critical water balance as well. So it helps to prevent like transepidermal water loss, you know, thereby giving proper balance to the skin and level of hydration. It protects this same part of the skin, protects against toxins, microorganisms. We've already talked about dehydration. That's the protecting against loss, transepidermal water loss. It protects against ultraviolet rays, which damage the skin, and then as well as irritation, inflammations, and mechanical damage. So those are the things that this layer can do as per its protective function. As for the barrier functions, of course, protects the body also against free radicals and reduces the effects of UV radiation. It acts as a permeability barrier against the evaporative water loss from inside of the body to the outside. It can also block entry of, entry of some topical drugs so that they are not like absorbed whole like that into the skin. Symptoms such as dryness, flaking, itching, and inflammation can alert you to a disturbance in this important barrier, because by the time you see very dry skin, it means that there is excessive loss of water from the skin, flaking, and all that may also be a result of either overproduction or irritation of this area of the skin. This little diagram here shows the normal stratum corneum intact, and therefore prevents irritants, allergens, microbial organisms from entering. And water loss is also controlled, so the water cannot escape, okay? The disrupted stratum corneum will allow all of this to happen, as well as allow or permit increased water loss. Any breach in the skin, this skin that is a shield for the body, any breach in it will lead to penetration of these harmful substances, environmental agents that the skin is meant to protect against. And things like UV light, trauma, irritants, and infections, we know that these are things that can cause a breach in the skin, okay, in the skin layer, and therefore allow all these things that are not supposed to get in there, or water to get out. Then, apart from the barrier function of the skin, we have the sensory function of the skin. It's responsible for pain, sensation, feeling temperature, whether it's cold, hot, and then for deep pressures, the skin can also sense that. Some parts of the body, like the hands, lips, genitals, and feet, have extra share of sensory capability. Hence, they occupy more spaces on the somatosensory map, which is like what this diagram goes to show. Like the lips, you see, those areas that occupy more space on the somatosensory system, that, increased sensation in those areas are marked using this homunculus man, this little man here. This is the somatosensory map. You can also still see how these different parts of the body are represented, and the ones that are like the face is given extra, space, because extra sensations can be felt from there. The skin also has immune function. As an immune organ, it can detect and clear infections through expression of antimicrobial proteins against bacteria, fungi, viruses, as well as through the functions of skin commensals like staph epidermidis that help to form the more normal microbiome of the skin. The Langerhans cells act as the outermost guard of the cutaneous immune system and are likely to induce the first reactions against pathogens encountered via the skin. So they kind of sense, most of these things early before other parts of the immune system can sense them. This is the Langerhans giant cell, Langerhans cell, not the Langerhans giant cell. This is Langerhans cell, okay? And so having talked about this, the next is the temperature regulation function. It carries out this by conserving or releasing heat and helps to maintain the body's water and homeostatic balance. We've talked about the fat, the subcutaneous, the layer where you have the lipocytes that can be involved in thermogenesis, or if you need to lose some heat, you can a little bit of coordinating water loss in a way that it will not affect the homeostatic balance of the skin. The hair also is involved in preserving heat by trapping in some air under, thereby providing an envelope that can help to maintain some heat. Then other functions of the skin, like it also aids in mobility. We know that anywhere that the skin is very tight, it's going to be difficult for the skin to move smoothly, especially if it is over a joint. And then if there is hyperelasticity or or very lax, the joints in those areas can be very lax, and so joint mobility can be affected. Situations where you have things like Ehlers-Danlos syndrome, where you have laxity of the elastic components. Then the endocrine functions of the skin include production of vitamin D. We know that completion of the production of vitamin D, part of it goes through the skin. The skin is also an organ of excretion for waste products like urea, lactic acid, ammonia, as well as heavy metals via the sweat glands. Encouraging sweating can support some of these excretory pathways. Exocrine activity of the skin will occur by release of water, urea, and ammonia. Skin secretes products like sebum, sweat, and some pheromones, okay, that help to protect the moisture component of the, or secure the moisture components of the skin. It's also, the skin can also exert its immunologic functions by secreting bioactive substances like cytokines. Then what are the mirror functions of the skin? Because we said it's also a mirror. It can reflect a person's mood or non-verbal responses, like when people are shy or ashamed or embarrassed, they may blush. When people are afraid, they may have hair on end appearance triggered by the sympathetics. And this is where the tiny muscles around the hair follicle will contract and make the hair to stand on end. That's the... Then the skin also can glow when a person is happy or in a fulfilled mood, as well as lose gloss when the person is stressed or dehydrated. Further to the mirror functions of the skin, systemic disorders can present with skin manifestations. and ranging from tuberculosis, chickenpox, measles, herpes zoster. Most of these are systemic disorders that will manifest on the skin. Even things like meningococcemia, rheumatic fever, as well as anaphylaxis, angioedema, urticaria. Even food allergy can manifest on the skin, not just in the digestive system. And the skin, when someone is on chemotherapy, we see that the skin can also manifest, and you may lose hair or get darker. And then when you have liver disorders, they can also manifest by all those spider angiomas. Then malnutrition and other nutrient deficiencies, we know about kwashiorkor, we know about our beriberi, the Castle's necklace, and Pelagros boots and all that. So these are manifestations. This is just one example of a systemic disorder that is manifesting on the skin, meningococcemia. So having talked about some of these functions of the skin, I just want to mention that the bare skin, being the organ for aesthetics, is also prone to abuse. Of course, the bare skin is bleached, tanned, toned to all shades on the, either is bleached to, higher scales or toned, to the lower scales on the Fitzpatrick scale. And excessive exfoliation goes on where people are trying to make the skin look smoother or one thing or the other. It's injured extensively in a bid to make it slightly better than it appears. The scalp hair, the traction during braiding or the bleaching of the hair or dyeing of the hair, all show the kind of things that can go on, what uses the hair are to people, for the purpose of beautification, so while being styled extensively, they can induce some trauma. Of course, people shave off the hair at will. They can be extended as needed or totally covered with wigs. So these are the things that we do with our skin and these appendages. The brow and lash of the skin, which, they are plucked, shaved, waxed, tattooed, highlighted, or shaped according to trends. But we know that these lashes also help to protect the eyes from, things like dust from entering the eye or regulating the amount of light that gets, into the eyes. The hair of the nose, in the nose, ears, and around the eyes protect these sensitive areas from dust and other small particles. I've talked about the one of the brow. The nails, which are often marked with colors and extensions, they function to protect the digits, enhance sensations and precise movements of the fingertips, as well as acting as tools for tearing and scratching. They also mirror many cutaneous or systemic disorders, example, anemia, psoriasis. This can be shown on the skin. Even when someone is on things like chemotherapy, it can show there. So the skin dynamics is multiple layered, sheds outer layer and replaces inner layers. Thickness and density varies based on its location, age, gender, medications taken, and state of health. Thick on the palms and soles and thin on the eyelids, axilla, genitals, and external mucosal surfaces. Androgens are responsible for relatively thicker skin in adult males, and the skin thickens from childhood to adulthood till about the 4th decade. Then thinning starts by the 5th decade. However, genetics will play a role as well as degree of exposure to sun and UV rays and the state of health of the patients. Of the person, of the individual. Talking about the facts and fallacies now. Most times the skin is provoked because they believe that by scarifying it or etching things into it, it can be used to treat some assumed spiritual ailments and act as protection to ward off some evil spirits and all that, you know. But we know that most of the time, these marks cause severe injuries as well as delay the person from getting proper medical attention and intervention, and may result in undesired appearance by the marks that they leave on the body, and therefore lead to poor body image. Okay? And you know, some people have said that they resent wearing their ID cards on their faces because of the scarification marks that have been given for identification of their racial or ethnic groups. Then we have the tattoos and other marks that are used as a statement of beauty, class, but they are sources of infection and some even needles for skin malignancies. Social implications of some of the things done on the skin, you know, like the rites of passage into adulthood and all that. Yeah, but most of these things don't have to be done on the skin. Okay? That people think, oh, if this mark is not on the skin, it shows that the person has not come of age. And then there are also marks that are put on the belly of children for any abdominal swelling, irrespective of the type of organomegaly that the patient has. And they feel it's going to cure the ailment, and they call them a powerful treatment. And it goes on all over the place, even till date. The fact here is that they cause injury, delay proper treatment, and serve as the needles for infection. This is like one of the marks that they give to the skin, insulting the skin as a way of treating what is perceived to be inside. The fact about it is that these are mere marks that they give to the skin and will do nothing, you know, to reduce those abdominal organs.
Hello,
and
Prof.
then some of the fallacies that come up these days about consumption of collagen as food, drinks, tablets, that it will make the skin to remain wrinkle-free. Wrinkles occur, the fact is that wrinkles occur because of loss of skin elasticity due to reduced production of collagen, as well as loss of skin contents, you know, of the collagen, among other components of the skin. And this happens as somebody gets older. Consumption of collagen pills, powders, and tablets will not selectively repair the skin, but its content, among other proteins in the food, can help in body repair. So balanced diet is more important than gulping single nutrients and spending so much money, hoping that, oh, when you take it, you're not going to have wrinkles again, or that you're going to retard or even reverse the wrinkles that have already occurred. Water, you know,
Hello, Prof.
you can trap in water or lock in a moisture with sealers like good moisturizers, and this will help to prevent wrinkles on the skin. And then that's for the consumed collagen. Collagen is also touted as per on the skin that it's going to retard wrinkling and all that. We're not saying that collagen is useless, but it will not penetrate to repair the skin. But the moisturizer components of the topical agents will help lock in moisture and, you know, make you feel better and look better. And collagen can be a good humectant. So proper hydration will improve the hydration status of the skin.
Hello,
and then
Ma,
some other. Hello?
Okay, Ma, please, you should be rounding up now.
Yes, I will. I'm almost done.
All right, Ma, thank you.
Okay. Other fallacies are like use of antiseptic soaps and creams, that they are better for skin health. But we know that routine use of these will wipe off the normal protective flora of the skin. So frequent use of these antiseptics can alter the natural skin microbiome. Then skin color perceptions, lighter is better, is a fallacy. Healthy skin is always preferable, irrespective of the skin tone that the patient has. And then one of the trending fallacies these days is about treatment of acne with things like semen and all that, called sperm facials, that they contain healing agents like zinc and antioxidants. But the fact is that the quantities contained in these seminal fluids and all that, are too small to have an effect. And there are other abundant sources of this. Moreover, this can expose people to sexually transmitted infections. And then the last part of it is sometimes people say, I've grown thick skin. My own is I have a thick skin. It's a way of telling you to toughen up because you are too sensitive. But the fact is that emotional sensitivity is a virtue, and the state of the skin has nothing to do with it. Thank you very much. Sorry for taking most of your time and the initial glitches that we heard. Thank you.
All right. Thank you so much for such John. That was a quite enlightening session and all that. Thank you so much, Ma. Please, if we have any question for our first resource person, you can drop it on the chat box and it will be addressed. I don't see any question on the chat box. So thank you, Ma. Thank you for your time. We appreciate you. Thank you so much, Ma. All right. So we'll be going over to the second speaker for today, and she is Dr. Belema Regina Omuso Abi.
Sorry, I put a question down.
Oh, sorry, I didn't see that. Oh, please, okay. Hold on. Can you please put it again?
Hello?
Just that. All right. There's a, oh,
Am I to take the questions now? Hello?
all right.
Am I to take the questions right away?
Yes, Ma, you can just go ahead. I think our network is bad, so you can just go ahead, Ma.
Okay. Okay, somebody asked something about hidradenitis suppurativa. When would somebody outgrow it? Well, most of these chronic disorders, what happens is that most times with time people learn to take care of us with better knowledge of their, of their skin types and what provokes their disorders. So it's more like treatment of most of these disorders are like a program. And with time, you get to know what to do. And when you are handling it effectively, it will not look like, it will look like you have outgrown it, but because you know exactly what to do about what causes it, what triggers it, what to do at any point in time. So really outgrowing it, it's neither here nor there. Organic creams and soap, is one of the buzz in the cosmetic industry. But there's nothing that says organic is necessarily better than, okay? There are some organic creams that people react to. So if you find the ones that are okay for your skin, that are not irritating, will not cause more inflammation or drying, but don't take it down that organic, once something is organic cream or is organic soap, that is necessarily is safe and it must be used. There are some synthetic products that are also good and can handle your skin type even better than some of those organic creams. Somebody asked about getting the, okay, we'll talk to the, maybe through the organizers. Somebody talked about getting the presentation through the organizers. You can get that. Is it possible to reverse wrinkling of skin? It's not like magic. but you can improve your skin texture. But reversing wrinkling is a very difficult nut to crack, because what has led to the wrinkling? Loss of elasticity and loss of part of the collagen and all that. And but if you are in better hydration and in better state of health, you can at least. And then prevention of effect of UV rays, because those are the major things that lead to wrinkling. Those things can help you to stem the tide of increased wrinkling of the skin. That's which is kind of skin aging. Okay. I think that's spiritual exercises and healthy skin. I don't know what kind of spiritual exercises, but if it is meditation, or is it the one that they etch things into the skin? I've already talked about that. People talk about yoga, talk about all sorts of things, and tout it that it can almost do anything. So, antiseptic, routine use of antiseptic.
Thank you so much.
Yes, should be discouraged. Thank you.
Hello, can anyone hear me?
Okay.
Hello. Oh, okay. Thank you so much, Prof. So because leave the questions for later on.
Okay,
right?
No problem.
We'll just leave the question for. Yes, ma. Thank you so much, ma. So we'll just take note of the questions and address them at the end of the presentation. So our next speaker for today, excuse me, is it's our very own Regina Almost, who is a consultant in the Department of Internal Medicine, ABTH. She's a specialty fellowship in dermatology. She also has a part-time fellowship of the American College of Anesthesiology. She currently works as a consultant physician and dermatologist at the University of Port Harcourt Teaching Hospital. She's the Assistant Secretary of the Research and Education Committee of the Nigerian Association of Dermatologists, a member of the Dermatology Curriculum Review Committee of the West African College of Physicians. She's a support and resource person for sleeping with albinism in Rivers State, and the founder and chairperson of Okolama Doctors Forum. Her research interests include immunotherapy of the in community education, and has given multiple radio health talks and written social media articles on various topics concerning the skin. She's an ambivert and loves to dance. She's married to Mr. Almost Gordon Abbey and has 3 kids. So with a heart full of joy, we welcome her. Over to you, ma. Can you hear me?
I can hear you. Can you hear me?
Yes, I can hear you. Welcome,
yes,
ma.
you can. Thank you so much. I've had such a horrible time with network today. I hope that this is now steady and you can all hear me. So please, can you project my slides, because I can't seem to do it here. Network has refused for me to. Oh, wow.
All right, Mike. It's up now, ma.
Okay. Let me rotate this. Okay. Good evening, everyone, members of the Christian Medical and Dental Association, Rivers State and Nigeria. Good evening, doctors. Good evening, students. I'll be speaking on cosmetic camouflage is all well. So I'll start with definitions. So according to the Oxford Dictionary, cosmetics is something that is relating to treatment intended to restore or improve a person's appearance. It's also defined as affecting only the appearance of something rather than the substance of the human. In this question, we're talking about human beings. And camouflage is gotten from the French word camoufleur, and it means to obscure or to blunt, and is defined as a combination of materials, colorations, or illuminations that alters or obscures appearance in order to conceal something. So when I first get this topic, I was musing, I was thinking this is one thing that you can relate to the story sometimes that you see on social media concerning instruction given to Angel Gabriel. You know, Angel Gabriel is that angel where when Nigerians want to describe anything that happens with an angel, it has to be Angel Gabriel. So Angel Gabriel was waiting at the pearly gates of heaven, waiting to send back one of God's loved female, because her time on earth wasn't yet up, and God needed her to be back on earth to continue serving him and to fulfill her purpose. Angel Gabriel waited in vain because the person, next slide is, the person that Angel Gabriel was supposed to be waiting for looked like the person on the left, was born with melanin complexion, beautiful skin, looks like that. But she came to Heaven's Gate looking like the person on the right. And over time and recently, the actress Moyo Lawal has further lightened her skin to look like the person on the left currently. Forget the difference in the nose. That's another way of cosmetic camouflaging. She has narrowed her nose with cosmetics to look like the one on the right. And you can see an inscription there, waiting do her skin. Actress Moyo Lawal under fire for allegedly bleaching her skin. This is an example of dragging in Nigerian social media parlance. Dragging is when you consistently, persistently criticize someone for something. Moyo Lawal right now is a cosmetic skincare influencer, and she's propagating the Michael Jackson cream. You know what that implies? A cream, especially on this her really light picture, a cream that's supposed to give you this exact complexion. Funny enough, Michael Jackson can be a prototype for cosmetic camouflaging. Michael Jackson is said to have suffered from vitiligo, and consistently throughout his adult life and his later years of life, he had tried to make his skin even, and even tried to change his features to look a bit more Caucasian. Was all really well with Michael Jackson. Sadly, we lost him to a complication of drug use. Next slide, please. The human skin, in addition, next slide. The human skin, in addition to its physiological, hello, can you hear me?
Yes, ma, we can hear you.
We
can hear you.
Can you hear me?
Yes, we can hear you. Hello, ma, please go ahead.
Can you hear me?
Can hear you.
We can hear you.
Yes, ma, we can hear you.
Hello.
We can hear you.
Okay. Hello. Next slide, please. The human skin, in addition to its physical and physiological. Oh, okay. Okay. The human skin, in addition to its physical and physiological functions, tells us a bit about our age, our ethnicity, our general health status, can even look at emotions through facial expressions and aesthetics of our physical look. You can look at somebody in Nigeria now and say, oh, you're light-skinned. Are you Igbo? Or I'm from the South. Oh, no wonder you're very dark. Are you Bayelsa? So it can really give a bit of your ethnicity. There is a universal need to want to be good looking. So having visible areas of your skin looking aesthetically pleasing is what almost everybody wants. And especially in today's beauty reliant and aesthetic reliant society, the physical appearance is actually an influential factor in your personal, social, and professional interactions. It's also influenced by the way the media defines beauty and the way the media says beauty should be presented. Next slide. So our appearance is really genetically predetermined. Your phenotype, your skin color, your nails, your hair, the color, the texture, genetically predetermined. But over time, our lifestyle, environmental influences, nutrition, and general health and skin condition, as well as skincare, can alter or modify it. And the way we perceive ourselves also plays a great role in accepting of the way we look, because there's a way you look and there's a way you perceive yourself to look. So the way we perceive ourselves actually determines that we can actually alter the way we look. We can alter the way we look with our personal expression of our style, using clothing accessories, makeup, hairstyles, barbing styles, etc. Next slide. These alterations, next slide, please. These alterations can be body enhancing, just to beautify our looks. It can be temporary. It can be permanent, grotesque. Sorry, I've had to present with my phone because of network issues. A call came in. Can I go ahead? I was interrupted by a call. I'm presenting with my phone.
We can hear you.
Okay. Okay. So all these are alterations in our body can be enhancing. It can be in the enhancement, it can be temporary or permanent, sometimes even getting to the grotesque. And we end up camouflaging our looks, whether it is really real or we perceive those imperfections. So now there's skin camouflage therapy. Skin camouflage therapy is a subspecialty practiced by plastic surgeons and dermatologists. Color me very surprised because I never knew there was a part of dermatology called skin camouflage therapy specifically. It's not that we don't know we can camouflage, but that there's a specific specialty for skin camouflage therapy was what surprised me in the course of planning for this presentation. As I was going through, I recently recall I and my senior colleague, Professor Bolaji, we saw a patient presenting to us with what looked like hypodepigmentation. So the skin was patchy white and yellow, but had black, apparently normal pigmented skin in the middle. And as he walked up to me, I thought, oh, repigmenting vitiligo. Not until he complained about paresthesia, funny pins and needles on his hands and feet. He complained about being unable to feel his feet when he walks, and complained that his feet looked different. On examination, he had limb length discrepancy. One foot was shorter than the other. And our history led us to him going to a native doctor and getting instead of treating, getting something to pigment the skin. And Professor Bolaji said, we need this your native doctor's number. Let's know what he's using to pigment the skin. Since childhood, pigmentation remained. So this is a picture of skin camouflage therapy. Here is a patient with visible depigmentation, light patch on the upper back. It's called vitiligo. And the patient was given something to even the skin, and the skin looks almost normal. So camouflage can be therapeutic, as I mentioned. In history, use of cosmetics predates time. Earliest documentation is said to be over 7,000 years ago. And even in the Bible, Queen Jezebel was said to have painted her eyelids, and the book of Esther is said to have described various beauty treatments. The earliest culture is of the Egyptians, where men and women use several things to enhance their appearance. from using incense oils to beautify their skin, some oils to even protect them from sun damage, black antimony used as eyeliner, and a natural blush gotten from flowers. The history of camouflage dates back to a plastic surgeon from the British Royal Air Force who had to start looking for ways to correct scars and skin imperfections from World War II injuries, both born and otherwise. Another plastic surgeon from the British Royal Air Force brought up the guinea pig club then and tried various mechanisms to camouflage using one topical called the veil cover cream. Over time, there was the establishment of British Association of Skin Camouflage. For cosmetic alterations that are surgical, it dates back to the 6th century BC, where Shosotra was regarded as the father of plastic surgery, starting plastic surgery as far back as 6th century BC. In our own history, we have different ways of using cosmetics to either enhance our appearance or hide something. Even tattoo dates back to us pigmenting our skin by using henna and lali by the Hausas, uli by the Igbos. Even in Rivers State, the Ibani tribe, the Borneo and Opopo people, they use colorations on their skin when they go through a traditional rite of womanhood. Then some camouflaging that are or body enhancements or body changes that are very significant in history is that in China centuries ago and for several centuries onwards, girls between age 3 to 7 were forced to have small feet because they thought it was a sign of beautification. So these girls will be camouflaged by breaking all their toes except from the big toe, and it will be bound and wrapped tight so that the feet does not grow. And they continue this binding throughout their lives. In the Victorian era, women were said to wear corsets to change their appearance, making their skin as tiny as 12 inches just to give a wider hip. Corset in itself has returned back into our mode of dressing and way of expressing ourselves. It has gone from using waist trainers, now use corsets in clothing. Now, cosmetic medicine itself is both dermatological and plastic surgery related. So it's invasive and non-invasive. This is now methods where you use mildly invasive and invasive procedures to actually change this, the look of the skin and the person's physical appearance for personal satisfaction. So why go to the next slide, please? Sorry, can you hear me?
Yes, we can hear you.
Next slide, please. So what are the camouflaging methods? Next slide. So performed for a wide number of reasons. Aesthetic reasons, typically for people that are unhappy with their size, their shape, color, or texture, or some body part, just to change it in some way. And it includes various non-invasive, mildly invasive and invasive procedures, from skin bleaching, body piercing, breast implants, tummy tuck, liposuction, mommy makeovers, rhinoplasty, Botox, fillers, permanent makeups on the brows and lips, and body branding of different types. Can be for sexual enhancement. Rites of passages make people modify their bodies, like we have the female circumcision that is being wiped out, male circumcision, which is also for religious beliefs, nose piercing with people that practice Hinduism. Military personnel get tattoos that feature emblems and mottos of their sects of the military or their countries on their skin to create the shock value, to stand out, and sometimes for expressing self-expression like tattoo enthusiasts. The use of cosmetics or cosmetic materials like makeup, concealers, clothes, hairs, wigs, and then strength training to try to modify our body, and then the camouflage therapy that dermatologists and plastic surgeons use on patients that have either congenital or acquired skin conditions that treatment is not usually rapid, or patients have to use this to live with this all through their lives. So it's all well. Why are people going through all this to either permanently or temporarily enhance their looks, change their body structures, and do all of this? So first of all, when somebody has a skin imperfection or a skin disorder, initially, the person's physical appearance, especially if the skin disorder is on visible areas of the body, like the hands and hands, face, arms, where the person has to have physical contact with people, it makes the person have social anxiety and have mental health problems. What with the stares, the questioning, the offer of advice, the being unable to keep personal relationships, it actually affects their quality of life. And so leads them to have personal dissatisfaction with their response, with their appearance, or response to the reaction of others. It can become aggressive, end up being depressed, have anxiety, and even suicidal ideations. Then the society's idea of flawless skin and body shape is largely influenced by what the media portrays. And we know in our heavily appearance-dependent media now, all these things are targeted at towards women. So when you are living with a perceived, because as I said, there's a way you look and the way you perceive yourself to look. Living with perceived unappealing skin or skin disfigurement that is either congenital or acquired results in real or perceived unusual or unappealing appearance, can be challenging in today's appearance-obsessed society. So as I said, the person has unique social challenges, is being stared at, feels the person is being stared at if you have a skin disorder, has to answer invasive questions, etc.
Hello,
Then
please
the
have
lack
5 minutes.
The lack of immediate and uniformly adequate clinical results from dermatologic procedures also leaves patients with complications like erythema, hyper and hypopigmentation. That's one of the reasons why somebody might want to camouflage the skin or alter the skin or enhance the skin. Other things that could make you want to enhance your skin is, next slide please, is going along with what your peers are doing. Peer pressure of this person looks good, did it, is fine, and I can also do it. I want to look as good as this person. I want to stand out. I want to glow. I want to have an hourglass figure, etc. Can make you want to modify your skin. So this is an example of a cosmetic camouflage where someone has primary and secondary lesions from acne and has used cosmetics to change their appearance. Next slide.
Oh, Lord.
So this other person has melasma,
Wow.
epigenous ochronosis. The patient has used cosmetic to change her look. Of course, you know, this patient with this, the previous patient and this one will not be able to go out and interact with people with this face the way it is because of the stares, the suggestions, personal relationships, job opportunities, etc. Because our environment today is physical appearance heavy. So this other one shows someone with patients with skin disorders, melasma again, erythema on the other one, and vitiligo, and has camouflaged to look at least normal and appealing. And then we have the bizarre and the grotesque, those that want to do it for the shock factor. Okay, I want to now look like a cat. I want to look like an alien. I want to identify as this. So this make you go on to have bizarre, frequent appearance changing surgeries that make you look like this. The next one, this. Next, this. All for the shock factor. and to look different. Next slide. So what to do when you are considering an enhancement? Speak with your parents, spouse, pastor, doctor. Teach and practice self-confidence to our children, that young ones that are coming, to people that you mentor. Always affirm them. As children grow up, you affirm them and encourage them and tell them they look really good. So I will use my son as example. He has really full lips, and he came back and said, Mommy, they say my lips are too big. I say your lips are too big. The one that people are doing makeup. You know, nowadays, people do makeup over the line of the upper lip to get the skin between the nose and the lip, just to add to the volume of the lips. And here is my son feeling inadequate because its lip looks full. So you need to encourage, affirm, and tell your child, build your child's confidence by using these affirmation words and telling the child you look good the way you are. Most of the young ones are still growing up, especially those in puberty and early adults. You know, with childbearing, your hips will even get wider, your breasts will even get fuller. So all these things can change as you grow older. Try to get physically fit. Practice good grooming and hygiene. Change your clothing and hairstyle to express yourself better. All this and the things you decide to do is usually guided by your religious beliefs, your family morals, your personal beliefs, and your idea for safety. Or then you intend to do it to modify or enhance your skin temporarily for a definite purpose. Get mental health evaluation. You could be suffering from more serious mental health issues like body dysmorphic disorders, and you never knew. The next one. So what are the pros of doing any cosmetic surgery? To treat diseases, skin diseases, complications, some cosmetic procedures like Botox, street hyperhidrosis, repair clefts, repair any physical congenital disease on your skin, and then do temporary modifications or adornment to beautify. It doesn't take away, remember, cosmetics is defined as alteration that does not take away your persona, but it can temporarily change what you look like. The next one. What are the cons of doing this? The financial burden is too much. The complications, intra, immediate, and long-term, is always there. Regrets of doing these surgeries and needing reversal surgeries. You can be in socially unacceptable situations. You go for a job interview and they're like, you don't look appropriate for the job because of all the alterations you've done on your skin, the piercings and all of that. You now have to permanently live with these modifications.
Hello, ma'am.
You were trying to treat a mental health issue. Okay, I will soon be done. You were trying to fulfill your need to feel okay by modifying your appearance. You still have mental health. Next slide, please. Next slide, please. So how do we, next slide. So how do we evaluate and care for these people that become in contact, either as patients or in our immediate family group or social distant relationships? So we know that cosmetic surgeries or plastic surgeries are fraught with a lot of complications. One prominent death is that of the president's wife, Stella Obasanjo. You take good clinical interview if the patient comes to you as a dermatologist or as a physician, so that you can assess and apply psychiatric assessment tools if you suspect the person has a mental health disorder. Next slide. So these are the mental health assessments you can do. To screen for body dysmorphic disorder, there are questions coming after this to help you decide whether this person that's continuously seeking for these cosmetic alterations or camouflage has body dysmorphic disorder. Next slide. As I said, the way forward is words of affirmation and show of love by parents, family, and friends, to encourage people that they look as good as you see them in your own eyes, because sometimes people perceive themselves as different from what we see. Be kind to people with visible skin lesions. encourage psychotherapy. You can send the person for cognitive behavioral therapy or do an outright neuropsychiatric referral. Thank you very much for listening.
All right. Thank you so much, Maha. That was quite an interesting session. So it's interesting to learn that there's a camouflage subspecialty in dermatology. Thank you so much. All right, so we'll move over to our next speaker. Please, you can drop your questions in the chat box. They'll be addressed at the end of the entire session. So our next speaker for today is Professor Bolaji Otike Odibi, who is a consultant in the Department of Internal Medicine, University of Port Harcourt Teaching Hospital. She's an honorary consultant and dermatologist. She's an honorary consultant dermatologist and physician with the University of Port Harcourt Teaching Hospital and a lecturer at the University of Port Harcourt for several years. She's interested in neglected tropical skin diseases, acne, psoriasis, autoimmune skin diseases, and geriatrics. An author of over 50 peer-reviewed articles in recognized journals and has attended and presented papers at various workshops and conferences, both locally and internationally. She's a member of various associations, including the Nigerian Medical Association, Medical and Dental Consultants Association, UPTH, and Nigerian Association of Dermatologists, where she is the chairman of the MPOS committee. She's also a member of African Society of Dermatology and Venereology, International Society of Dermatology, and American Association of Dermatology. Professor Otike Odibi has co-investigated several multi-center studies on scabies, skin health, and psoriasis. She has a Part 1 certificate from the American Association of Aesthetic Medicine and a certificate in leadership and management from the University of Washington. Her hobbies include traveling, reading, watching movies, and listening to music. So for the next 40 minutes, Professor Otike Odibi will be taking us on the topic, adorable aging skin. Over to you, Ma. Hello, Ma. Are you on the call?
Good evening, everybody. Good
All
evening,
right.
ladies and gentlemen. I want to thank the Christian Medical and Dental Association for this opportunity given to me to give this talk today. I am grateful. Thank you very much. So please, can you share my slides?
It's coming up, Ma.
Okay. Okay.
Right.
Can it be on, can you put it on, yes, thank you very much. So I will be talking about adorable aging skin. I'm Professor Bolaji Otike Odibi has been introduced, and so I'll be talking about adorable aging skin. This is my outline. Can I have the next slide? So adorable means inspiring great affection or delight, something that is lovable and appealing. While aging means of the skin means when there is accumulation of defects in the cells and intracellular structures of the skin. Experts have found that aging skin typically starts around the age of 25. The skin is the second largest and the outermost part of the body, with a surface area of about 1.5 to 2 square meters. It is said to be the mirror of the body. Because when you look at the skin, you can tell what is happening inside the body most of the time. So we say the skin is the mirror of the body. The World Health Organization predicts that the number of people aged 60 years and above will double before the year 2050, reaching about 2.5 billion. With increasing life expectancy and prolonged solar exposure, skin aging is becoming a major issue. And its final step in the elderly may be chronic cutaneous fragility syndrome, which is characterized by extreme skin atrophy, which is dermatoporosis. This leads to loss of mechanical function and makes the skin susceptible to tears produced by minor stress or pressure. So what I'm trying to say here right now is that people are beginning to live longer. And so by the year 2050, we expect that the number of people aged 60 years and over will be doubled, reaching about 2.5 million. And with this increasing life expectancy and prolonged solar exposure, because right now, we all know that The atmosphere is getting hotter. Anytime you go out in the afternoon, it's so hot. We have a lot of solar exposure. So skin aging will become a major issue in the near future. It has already started to be an issue now, but it's even going to get worse as people live longer and get exposed to the sun for longer. And we have this chronic cutaneous fragility syndrome, which is known as dermatoporosis. And we have it causes the loss of mechanical function and makes the skin susceptible to tears produced by minor stress pressure. Next slide, please. Next slide. It therefore results in significant morbidity and mortality because this problem with the skin is already having, this fragility, can lead to soft tissue infections, the risk of which is further increased by delayed wound healing. The estimated prevalence of dermatoporosis ranges from 30% in patients aged 60 years to 37.5% in patients over 65 years, with a higher prevalence in women than men. We have women being about 43.9% in women compared to men. And the fact that women are increased might be due to the fact that women undergo menopause. And menopause also adds to the problems we have with aging because the reduction in estrogen causes women to even age more and for aging signs to show more. Next slide. Pathophysiology. The cells in the skin reach a state where they escape apoptosis, which is cell death, despite the accumulation of damage to their DNA and organelles, and can no longer proliferate. This is now known as cellular senescence and plays a key role in the altered function and appearance of aging skin. Compounds able to induce the selective cell death of senescent cells are known as senolytics, or substances that reduce the senescence-associated secretory phenotype, SASP components, are known as xenomorphics, and are part of the anti-aging strategies. So what I'm trying to explain here is that a lot of cells escape apoptosis, cell death. And despite the fact that there's accumulation of damage to their DNA and organelles, they can no longer proliferate, and so they accumulate. And this is known as cellular senescence. And this plays a key role in the altered function and appearance of aging skin. So we have a lot of aging skin because a lot of cells are supposed to die because they're no longer proliferating, but they're not dying off, they're accumulating. And they allow the skin to look aged and look older. And compounds that can induce the selective cell death of the senescent cells are known as senolytics. Others that reduce the senescence-associated secretory phenotype are known as xenomorphics. And they all play a part in the anti-aging strategies. Next slide, please. So this is a photomicrograph of a normal and aged skin. So if we look at picture A here, we can see the basket weave appearance of the stratum corneum. We can see the rete rigid being well outlined here, and we can see the dermis and the subcutis. But if you look at picture B, you look at the stratum corneum here. You can see that the stratum corneum is now flattened. It's no more wavy and undulating like the other picture. It's atrophic. You look at the rete rigids here. All the elongation and the modulation you found in the other picture are lost here. You can see that it's also decreased. So all these are signs of atrophy of the skin, which you can see in aged skin. Next slide, please. Next slide, please. Etiology of aging skin. Genes. Genes play a major role in the etiology of aging skin. The degree of skin aging, especially that which is caused by sun exposure, is significantly affected by a person's Fitzpatrick phenotype and ethnicity. Fitzpatrick types 1 to 3 are more susceptible to photoaging, which is sun damage, than people of color Fitzpatrick phenotypes 4 to 6, which include people like us, Africans, African Americans, Asians, Latinos, and Hispanics. This happens because the melanin in the skin protects against sun-induced aging. So we Black people, people of color, are protected against sun damage and sun aging because of the melanin that we have. Next slide, please. There are two types of skin aging. We have the intrinsically or chronologically aged skin. which is the unblemished, smooth, pale, dry, and less elastic with fine wrinkles. This is the normal aging that comes as we age normally. As we all age and get older, we will have chronological or intrinsic aging. Then we have the extrinsic skin aging, which is photoaging, and it's due to the external factors. And photoaging is characterized by quartz, deep wrinkling, rough texture, telangiectasia, irregular or mottled pigmentation, a sallow or yellow complexion, and a loss of elasticity. Fairer skin is affected more than darker skin. So people who are fairer and people that have Fitzpatrick types 1 to 3 are more likely to age faster and be affected by photoaging, sun damage, than darker people and people that have Fitzpatrick types 4 to 6. Next slide, please. External factors. Other external factors too that can cause aging are smoking. People that smoke will tend to age faster than people that don't smoke. I've already talked about ultraviolet radiation. Then chemicals. Some chemicals that are found in degreasers and in chemicals, like laureth sulfates, and can cause aging of the skin if it comes in contact with the skin. Hydration. If you do not hydrate very well and you are losing a lot of fluid, you might age faster. And skincare. If you don't have a normal skincare routine, which we will talk about later, you will tend to age faster. So clinical features of aged skin are smoking. Next slide, please. Okay, clinical features of aged skin. We have xerosis, which is one of the most common, which is dryness of the skin. You find people that are aging and have aged skin tend to have very dry skin because they are losing a lot of water. Their transepidermal water loss is increasing. Their barrier function of the skin is lost. It's not as efficient as it used to be. So they tend to have dry skin. You have wrinkles because of diminishing of the elastin and the collagen fibers in the body. So you have formation of wrinkles. They have mottled and skin and hyperpigmentation, in which they have many colors. Instead of a uniform complexion, they now have black and white. You have a tendency to have more black spots than normal. You have quartz irregular skin. You have dermatosis papulosa nigra, which is the black spots and moles we see on the face. Seborrheic keratosis, which you see on the face and the body. Idiopathic guttate hypomelanosis, which are the hypopigmented patches you tend to see on the legs of people. And skin cancers. Skin cancers tend to increase more. Skin cancers tend to increase more as you get older because your body has been exposed more to the sunlight and has become more photo damaged. Next slide, please. This is a picture now of a daughter of 26. You can see how beautiful her skin looks, supple, fresh, filled out, no wrinkles. As I say, fine girl, no pimples on this side. Then you see a mother of 64. You can see she's white-haired. You can see the wrinkles around her eyelids. You can see the complexion here becoming sallow and darker. You can see the prominent nasolabial fold here. You can see the sagging of the face around here. All these are signs of aging. And this all shows that the patient has started losing elastin, started losing collagen, and the skin has started to sag because of loss of elastin and loss of collagen here. Now you look at the same patient again. The daughter, you can see all the fullness of the face and the skin tissues around here. You go to her mother of 64, and you can see here, there is a folding here underneath the eye. You can see there's a loss of skin muscles here, atrophy of the skin here, which wrinkles around the lips here, and also the sagging of around the face here. Also, this next slide, please. This is a picture to show the different stages of aging of the skin. You can look at it. The same picture, this is the same person with different pictures through her lifetime. This same person here, sorry. You can see the face looking supple, fresh, no wrinkles, nothing around here, no wrinkles at all, no sagging. When she's older, you can now begin to see the wrinkles on the forehead. You can see the wrinkles around here. You can see the prominent nasolabial fold. You can see the wrinkles around the cheek here, and you can see the sagging of the jawline here. As she gets older, you can see the wrinkles are even become much more prominent than before. You can see them around the forehead. You can see them around the eyes. You can see the nasolabial fold is much more prominent. You can see the sagging of the jawline is worse. You can see that this wrinkle here is even worse than before. So this tells us that as we grow older, we begin to lose skin tissue. We appear to have more wrinkles. Our skin will sag. That this is just a normal aging process, and it gets worse by photoaging and other external factors of aging that patient comes in contact with. Next slide, please. This is a picture of this popular actor. I'm sure we all know him, Morgan Freeman. If you look at his face here, you can see these black hyperpigmented papules on the face. All these are dermatosis papulosa nigra and a few seborrheic keratosis, and they're all signs of aging. Some people have it when they are young, but it gets worse as you age, and it's more in people's skin of color. You come to this leg here, this lower limb, and you see a lot of hypopigmented macules all over the legs. This is known as idiopathic guttate hypomelanosis. And it begins to show once a person is 40 years and below. So you can see that it becomes more and increases more and more. And this displeases a lot of people, especially women, because they feel disturbed by it and they actually want to camouflage at this point in time. Next slide, please. So management of aging skin. Hyaluronic acid has feeling, hydrating, and viscoelastic properties. It helps to moisturize the skin. So we need to moisturize. We need to moisturize more and more as we begin to age, because your skin hasn't got enough elastin and collagen. It's now become more drier. You have more cirrhosis, so you need to moisturize more. Then retinoids are also very good because they inhibit collagen degradation. They reduce transepidermal water loss. They promote keratinocyte proliferation and collagen synthesis and improve the epidermal barrier function. So application of 0.5% retinoic acid for 6 months improves the fine and coarse wrinkles, roughness, and skin laxity, and has been said to actually improve wrinkles by research that if you apply retinoic acid consistently for 6 months and you use your sunscreen with it, improves wrinkles, roughness, and skin laxity. Then ascorbic acid is a cofactor in the biosynthesis of collagen and elastin and induces collagen synthesis in humans' skin, fibroblasts, and increases dermal thickness. Next slide, please. So if you actually use ascorbic acid for about 6 months as well, you find that there will be an improvement in the texture of the skin. It will reduce skin aging, and it will also reduce the expression of free radicals. Next slide, please. Hyperhidroxylic acids, glycolic acid, lactic acid, citric, and mandelic acids can be used in cosmetics to moisturize the skin and improve the appearance of the wrinkles, skin texture, and skin tone. So a lot of cosmeceuticals have glycolic acid, lactic acid, citric, and mandelic acids in them. And they all help to, when they're all used in cosmetics, they help to increase the moisturization of the skin, improve the appearance of the skin, reduce wrinkles, improve the texture, and the skin tone. Then beta-hydroxylic acids are salicylic acids, reduce sebum, and improves the appearance of the skin, making it less coarse and irregular. Next slide, please. Oral supplements. Just as Professor Azumta said when she was giving her lecture, a lot of people are taking oral supplements now, believing that if they take that, it will help to stop wrinkles, help to reduce aging and things like that. But a number of oral supplements I've listed here. Polypodium glucatones is said to have UVB/antioxidant properties. Lycopene, which is carotenoid, which you find in tomatoes, carrots, and things like that, helps with sun protection. Oral enzyme Q10 is said to have antioxidative and anti-inflammatory properties. Oral vitamin C helps prevent aging and photoaging. Then hydrolyzed collagen or hyaluronic acid can cause long-term safety issues in patients with cancer. So just like Professor Azumta said, evidence supporting effectiveness of oral supplements is weak. So having a healthy and well-balanced diet and use supplements only when there's a deficiency of these supplements. So it's better to just eat a healthy and balanced diet. I know everybody will say eating a healthy and balanced diet is very expensive in Nigeria today, but we can go out and look for the cheaper things to use, other alternatives that we can use that would help to give us these oral supplements that are said to be expensive and people are using. So these oral supplements can have side effects that can even cause cancer, as some of them have said, as some research has said. So it's better to just eat this healthy diet as much as you can, and only take the supplements when you have deficiency. I'm just laughing. I just saw a question. Somebody said cheaper than what now? Just try and eat healthy diets as much as possible. Try and eat the cheap variants of healthy diet. There are always cheaper variants of healthy diet, of things that you can find. I know tomato is 500 naira for a healthy diet. You can look for something else. Thank you. Next slide, please. Procedures. We have resurfacing procedures. We have ND-YAG and carbon dioxide lasers for facial rejuvenation. They are very good at for facial rejuvenation when you do, and if you do an ND-YAG and it's CO2 lasers, you end up going for procedures if medications fail and topical creams fail, then you might need to do some procedures. So resurfacing procedures, as I've said, is ND-YAG and carbon dioxide lasers for facial rejuvenation. Then you can have chemical pills, like I've mentioned. You have hydroxy pills, you have glycolic, you have lactic, you have citric, you have mandelic, and you have superficial pills, medium pills, deep pills, which will all help. Then you have dermabrasion, which is a mechanical exfoliation. The chemical one is using the pills, but the mechanical one is a dermabrasion, which helps to smoothen out the skin as well. Then you have Botox that can be used for reduction of wrinkles and creases. Botox is better for the upper face, and fillers and platelet-rich plasma is used for replacing volume loss and reduction of the nasolabial folds. So fillers are better for the lower half of the face. Mesotherapy too is used for facial firmness and radiance. A mesotherapy means when you inject substances into the middle aspect of the face. Then you have threading, which threads can be used to lift up sagging skin, and thread is put into the inner surface of the skin and left there to help to lift up the skin. Then you have electrodesiccation for removal of seborrheic keratosis and dermatosis papulosa nigra, like what I showed for Morgan Freeman. Next slide, please. So prevention, how do we prevent aging, or how do we slow down aging? Well, because we can't prevent aging really. Aging is a natural process and it is going to occur whether we like it or not. But it's how to minimize it, how to make sure it is graceful, how to make sure that we still look nice even as we are aging. We need to have a good skincare routine. And a skincare routine normally starts with having a mild cleanser that you use to cleanse your face. Then you moisturize with a nice hypoallergenic moisturizer. You go for a sunscreen at 8 a.m., 11 a.m., and 3 p.m. because those are the times the sun is most active and the sun is hotter. And you start to incorporate anti-aging products gradually into your skincare routine to help slow down skin aging and to reduce blemishes. And these anti-aging products include retinol, serums, alpha-hydroxy acids, beta-hydroxy acids, hyaluronic acid, vitamin C. This can be started as early as 20s and 30s because, as I said, research shows that aging actually starts from the age of 25. And so it is important that you start to use them from your 20s and your 30s. Avoid direct sun exposure as much as possible. If you are going out in the sun and you know you have to go out in the sun, protect yourself, either by using a sun hat, using an umbrella, wearing long sleeve clothes as much as possible. Quit smoking because smoking increases aging and accelerates aging. Eat a balanced diet as much as possible. Stay hydrated because that helps to keep your skin supple. Drink up to 1,500 ml of water daily. Next slide, please. Good night sleep because skin heals at night. So most of the skin problems we have heals at night. So it's good to have adequate sleep, at least 6 hours sleep at night. Visit your dermatologist for a checkup whenever you see a suspicious wound because you never know the one that might end up being malignant. So a regular dermatologist checkup is important. Then stop using bleaching products. they make you age prematurely. Whether we like it or not, bleaching products will cause atrophy, they will cause exogenous ochronosis, they will cause wrinkling of the skin, faster wrinkling of the skin. They make us age prematurely. So as much as possible, let us stop using bleaching products. Treat comorbidities like hypertension and diabetes mellitus. Research has shown that idiopathic gouty hypomelanosis has been found to be more common in people with several comorbidities. So the more people that tend to have hypertension, diabetes, and other comorbidities tend to have more of idiopathic gouty hypomelanosis and can even be increased in them. Menopausal and premenopausal women. Menopausal and premenopausal women have to take extra care of their skin because reduction in estrogen can increase the signs of aging. Estrogen is a protection for women. And as women become premenopausal and menopausal, they experience xerosis, hyperpigmentation, hair loss, hairiness, and poor skin. So as you get to be menopausal and premenopausal, you have to take active care in looking after your skin, active care in making sure you are better moisturized, active care in using a sunscreen, because the protective effect of estrogen is lost at that point in time, or is reduced, not lost, reduced. Next slide, please. These are my references. Thank you very much.
All right. Thank you so much, Prof. That was a very enlightening session. So from this, I've taken that we should use a mild cleanser, a moisturizer, sunscreen, and then the other serums. I feel like asking you, Matt, to give us your routine because your skin is really glowing, right? All right. All right. Thank you so much, Ma. And that was our last speaker for today. And we'll just go ahead to attend to the few questions that are still in the chat box. Meanwhile, there is a link will be sent to the chat box very soon for a post-evaluation form. So please let's try to fill it. Right. So we'll just attend to the questions that I lost some of the questions because of network. I was logged out and came back and I couldn't find them. So I'll just ask the ones that I can see here. So all right, somebody asked, how can one prevent increase in the number of skin lesions in seborrheic keratosis? I don't know who to direct that question to.
Okay, let me
Prof,
answer.
if you can help us.
Okay.
Right.
Seborrheic keratosis, as I said, increases with aging. And it has been found out that people that bleach tend to have more seborrheic keratosis. So you can actually stop bleaching if the person is bleaching. That will help to decrease it. And also, the person can also use a sunscreen. That helps to reduce it. But if, despite all this, you're having increasing numbers of seborrheic keratosis, and they're not all coming out at once, because if they come out at once, it can also be worrisome. You have to be screened, because some research has shown that it may be associated with some malignancies. So if they're coming out a lot, you might need to go for screening, rule out some cancers like cancer of the ovary in women, and also some other kind of cancers. But if they are coming out a lot, despite you're not using any bleaching cream, you're not doing anything that should make it come out, then you should come and have it removed with electrodesiccation.
Mm-hmm. All right, thank you, Ma. There's another question here. It says, my question is concerning derma and deep cleansing facials. The session involves a lot of scrubbing and suctioning, sometimes resulting in abrasions. How healthy is that?
Sorry, I didn't get the question. You said derma. What do you mean by derma?
Derma. You know, there is an increase in all these. They said there are skincare parlors, right? They call it dermabrasion, I think. So
dermabrasion.
Yes.
No, dermabrasion is very good. Dermabrasion is a resurfacing procedure, and dermabrasion is a resurfacing procedure. And it actually helps to clear the skin surface and make the skin surface look better. So it's actually good for people that have rough texture skin. Dermabrasion is quite good. It's a mechanical form of resurfacing, which you can still get the same effect with the chemical peel. So dermabrasion is very good.
Okay.
It's safe. Yes.
All right. So the next question is, somebody's asking, so it means hormonal contraceptives tilt females to premature aging. So the person wants to know if contraceptives tilt females to premature aging.
Contraceptives don't tilt to premature aging. Using contraceptives is different from menopause. Menopause, your estrogen level is being decreased, but that is not the same thing for using contraceptives. So it doesn't tilt you to premature aging. Progesterone contraceptives and make you have more acne and make you have more sebum and things like that, but not to tilt you into premature aging.
All right. So the next question is, do vegans have slower aging of skin than meat-eating persons?
To be a vegan now is very expensive. Myself, to be a vegan is very expensive now. But actually, vegan it's very healthy if you can actually eat vegetables, balanced diets, tomatoes, carrots, things that are rich in lycopene and things like that. It's actually very healthy. So research hasn't been done. Everything in medicine is evidence-based. So maybe we should do some research and compare people that are vegans and people that eat meat like me and see who is aging faster. After that, we'll be able to answer that question properly.
All right, thank you, Ma. Then there's another question. It says, is sunscreen is it safe in children? What are the qualities of a good body cream and soap? What is your view on exfoliation? It's a three-pronged question.
Okay, sunscreen is good in children. There are specific sunscreens that are for children. So if you actually want your children to use sunscreen, you should go out and look out for the ones that are for children. Then you say, what is a characteristic of a safe soap? A safe soap is a soap that is in the pH of 5.5. That is the same pH as the skin. The pH that will at least not alter the skin, a soap that will not alter the skin pH, allow the skin to fight for itself. A soap that is not an antiseptic, not an antibacterial. A skin that we like soaps that don't lather too much. You understand, that have this pH they are near the pH of the skin, which is 5.5. That is a safe soap. A toilet soap, that's the kind of soap we want, and we think is most healthy.
All right, thank you, Ma. Okay, this other question I think is for Dr. Abi. It says, I would like you to lay some emphasis on the toxicological impact of so many cosmetics and camouflages being used these days. Dr. Abi, are you still with us here? Okay, I don't see her on the call. Please, I
She's
think
there. She's there.
Okay. Hello,
Hello,
Ma.
I can.
Oh,
Yes.
okay, Ma. Yes, Ma.
So yes, I should lay emphasis on the toxicological impact of so many cosmetics and camouflages being used these days. So the thing with the proliferation of cosmetic peddlers and the social media, kind of like showing them around to everybody, advertising them, is that these things have a lot of active ingredients like acids of strengths that are okay for creams and acids of strengths that are high and are medical grade and should only be used by dermatologists or aesthetic physicians. And the stories that you can move from one thing to the other, you can mix up actives. For example, people now use a lot of acids in their creams. Like Prof. Biology said, some acids, beta hydroxy acids and alpha hydroxy acids, in minimal cosmetic required strengths are okay for the skin. But if you go and use it in strengths that are medical grade, you could come down with irritant contact dermatitis. Your face could literally burn, and you come down with redness, sores, discharge, and all of that. And you end up having more complications than you would normally have had. Some actives are not supposed to be used together because people are not aware, like using retinol and vitamin C at the same time. Both actives can actually irritate each other. So you use retinol and vitamin C differently. What about the strength of retinols? In fact, on social media, you can see retinoids, because retinol is actually milder and safer. But retinol is being peddled and people use it anyhow. In fact, recently I heard they can use it on their skin, but it can actually even darken you. So this proliferation of cosmetic products can be toxic to you, especially if you use it off the counter and you believe these peddlers that don't know what they're saying. People nowadays use bleaching products for their children. They buy it in baby-friendly, supposed baby-friendly complexion maintaining products. These are toxic to your skin and to your organs. So the best bet is, if you want to get advice on skin care, you don't go on social media, because there you get a lot of garbage in and there's garbage out also. You go see a dermatologist that will curate skin care for you that is appropriate for whatever issue you have that you want to address, and will not be irritating to your skin, because you can take a lot of things that will actually give you complications. So yes, a lot of cosmetics can be toxic to you. Even the one that is normal for somebody else can be toxic to you. I hope this answers your question.
Yes, ma. I think it does. That was quite, exhaustive, if I may say, in such a short time. I don't know if Professor Chabjombo addressed these questions initially. Is it? I mean, I was logged out, so I can't. So, is it possible to reverse wrinkling of the skin? I think that was a question that comes earlier.
That.
Hello, Professor. Okay.
You say, is it?
Hello, ma. Is it possible to reverse wrinkling of the skin?
Like you heard the last speaker. When you already have wrinkles, you can use some of those fillers and all that to reduce the effect of the filling. But it's better to retard the wrinkling process, the aging process, than what it will cost you to start doing all those fillers, Botox, and all that. So all the things that can prevent you from premature aging should be put more in place, or so that the skin doesn't wrinkle fast, which is one of the signs of aging. So you can actually reduce the wrinkles by the use of all those fillers, and then some of the agents mentioned. But once wrinkling is part of the aging process, and it will continue. And what most people do at the extremes, they begin to do some of those cosmetic surgeries that were mentioned by Dr. Abe, like, facelift, chin tuck, all those kind of things, all to reduce the effects of the wrinkles that are going to be obvious with age and time, no matter what you do. But most importantly, prevent your skin from damage, especially from sun damage, and then from harsh chemicals that will, exact some toxic effects on your skin. So I don't know whether that answers your question.
Yes, it does, ma. Thank you very much. And we'll be if we stay here till tomorrow, we'll not exhaust this topic, right? Because everybody's interested in skincare, but we have to end here, right? Because we have to end here. So we'll be calling on Dr. Ekechi Amadi for closing remarks. She's the CME coordinator of CMDA Nigeria Webinar State. So please, Dr. Ekechi Amadi, over to you. Hello, Ma. I can't see her on the call. I think she was here earlier, but okay, she's here. Hello, Dr. Ekechi Amadi. Oh, can you unmute? Hello, can anyone hear me?
We can hear you. I can
Yes,
hear
we
you.
can hear you. Maybe you should call the chairperson for the state. So,
All right.
yeah.
Okay, Dr. Kanu, please can you take the closing remarks? Dr. Kanu is the Vice Chairman UPTS chapter. Over to you, sir. 2 minutes.
All right. Good evening, everyone. Yes, on behalf of CMDA Nigeria and Rivers State, I want to appreciate our erudite scholars for this quite enlightening presentation. In fact, we want to say thank you for actually doing expository presentation on skin and skin care. We want to appreciate all of you, Professor Sabjombo, Dr. Belema Ade, and Professor Otike Odivi. You people have really done justice to this team. We want to thank you. And every other person who has participated in this call, we want to thank you. Those from Rivers State, those from other states of CMDA, those at Abuja, those from other zones of the CMDA Nigeria, Eastern Zone and all that. And then I want to thank our CME department and our EBU chairman, Dr. Wanoma, for this great opportunity. I want to appreciate every one of you. Thank you for being in this call and then making this presentation a success. So do have a pleasant night rest. God bless all of you, please. Thank you.
Thank you, sir.
Thank you very much.
Let's take our closing prayer.
It's been a pleasure.
Thank you, Ma. Let's take a very short closing prayer. I can see Ma Korubo on the call. Ma, are you able to unmute? Dr. Korubo, please, can you? Very own Ma. I don't know if she's okay.
Yes, I have. Yes, please. Shall we pray? Shall we please pray?
Yes, Ma, please go ahead.
In Jesus' name.
Amen.
In Jesus' name.
Amen.
Amen.
Dear Lord, we give you thanks for the privilege to learn at your feet. Thank you for the wisdom to put this together. Lord, we thank you for the resource persons. Virtue has gone out of each of them. We ask, oh God, that you refill them. Lord, we cover our lives